Good morning, good afternoon, and good evening, everyone. I am Mary Jo Gordon-Cilio from the FAO Regional Office for Asia and the Pacific in Bangkok, Thailand. Today, I'll be talking about FAO approaches towards AMR mitigation through innovation in our work at RAP. In the interest of time, I will be skipping a number of slides for this abridged presentation. You can check in more detail the full presentation through the link provided in the chat box. You can also post your questions and comments directly on the presentation if you have any, and I will check and respond to them later. But just for your overview in that complete presentation, I have covered what is innovation and how to be innovative, and also talked a little introduced about the FAO strategic framework and the role of innovation in that strategic framework. But let me now just jump into the FAO strategic results framework, where innovation is considered as an accelerator. So one of the four cross-cutting cross-sectional accelerators in the FAO strategic framework for 2022 to 2031 is innovation alongside technology, data, and competence. This is to promote the overarching work of FAO towards better production, better environment, better nutrition, better life in support of the Sustainable Development Goals overall. It is worth mentioning here that agriculture innovation is broader than just technology, and it is the process whereby individuals or organizations bring new or existing products, processes, or ways of organizing into use for the first time in a specific context to increase effectiveness, competitiveness, and resilience with problem-solving goals. So this is not necessarily, it's not necessarily limited to technological innovations, as we will show you later. Now, as an example to approaching innovation, let me zero in into our specific area of work at the Emergency Center for Transboundary Animal Diseases at the FAO Regional Office for Asia and the Pacific, or ECTAD. ECTAD primarily works on risk mitigation, capacity building, policy advocacy support, among others. Under the risk mitigation, we are working on endemic zoonosis, emerging and re-emerging zoonosis with pandemic potential, and antimicrobial resistance. Some of the wide-ranging solutions to address these pillars of work include technological, institutional, policy, social, and financial innovations, which is well alongside the FAO strategic framework. More specifically and more practically, within the Global Health Security Program framework, innovations are taken on through the following approaches, including systems approach, behavioral science, novel tools, private sector engagement, new technologies, gender mainstreaming, foresight, among others. Innovations to address the major pillars of our work, including AMR, can be a combination of any of these approaches to innovation. Now, more specifically, on our work for AMR, we are taking a more systematic approach to innovation through this five-step process: technology gaps in identification, innovation scoping, product development, process development, and field piloting. We are now at the stage where we have done the technology gaps identification. We have initiated identifying gaps and needs on AMR for which innovative approaches may potentially address. These were gathered through field insights and feedback, implementation reviews, lessons, and experiences. We are now soon to be moving to the next phase, which is innovation scoping, where we will try to connect with innovators and review available literature and look at completed project works in the field. We will leverage on readily available innovations, be it on improving feed efficiency or infection prevention and control for livestock and aquaculture, which can reduce the need for antimicrobial use. Or perhaps maybe some novel approaches on alternatives to antimicrobials or antimicrobial stewardship technologies that can support, say, for example, antimicrobial usage at the farm level using new apps. So once innovation candidates are narrowed down and identified, we will be working and collaborating with these innovators through inventive problem solving, innovator collaborations, design thinking, and systems thinking. We will further define through process development with prototype testing and working towards feasibility and sustainability. And of course, finally, we will try to establish proof of concept and cost benefit of these innovations, including incorporating monitoring and evaluation in the process. So this is the systematic approach that we are doing at FAO RAP in terms of AMR mitigation. While we have just commenced with this systematic approach to innovation, some of our earlier initiatives has actually gone through this process. And an example is on antimicrobial susceptibility testing, or AST, in food and agriculture, because until recently, routine and active AST in food producing animals is fairly new to many parts of the region. So we have tried to identify gaps, which in a way we identified that lack of manpower, quality of testing, consistency with regional panel, and sustainability are some of the issues that deter them from working towards this. We then looked at what available innovation is out there, and knowing that we can customize broth microdilution plates, we did that through the Health of Technical Working Group, and we proceeded with product development. We worked with our manufacturers, and now we are able to say that we have established 3 regionally customized plates for the 4 indicator organisms that we have for the region, namely Salmonella and E. coli, Campylobacter, and Enterobacter, and Enterococci. Now, following that, because cost will still be an issue, we worked on a regional bulk mechanism for the procuring countries, because this is a system where we collaborated with the manufacturers, and they agree that we will have a tiered pricing scheme for the region where collective procurement of different countries will lead us to reduced cost for the procurement, for the individual procurements. And this we tested through field piloting, and indeed we found that these plates allowed us to have better harmonization, better quality of results, and also stimulated regional cooperation, private sector partnership as well, not to mention a better quality of results. Now, with this, we will continue to work on AMR, and we will continue to work with innovators, and we will be having an innovators forum in Asia in November 1 to 2 to 2021 provisionally. So we will continue to work systematic approach to better innovation, and we look forward to identify available breakthroughs, new applications, new approaches that will meet our identified needs for our ongoing work on AMR awareness, good practices, prudent use, and overall governance. So thank you for the opportunity to share this our work with you, and I wish you all a safe and happy weekend. Thank you. Bye.